Welcome to today's COVID-19 update. Of course, we're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you for having me on this program once again.
Yes, sir. It is the last day of the year, and we wanted to talk to you about school reopening. Just get that out of the way. We know that the Ministry of Health has been collaborating with the Ministry of Education to basically deal with the reopening of schools, and more so the Durham schools. Could you speak to us about that?
Yes, well, we have had an ongoing collaboration, and when school first reopened after a long closure, we worked with the Ministry of Education to make sure that students who were coming into the dormitories were safe. You would recall at the time when we did the testing that we found a number of students who were positive, and we were able to take precautions so that they would have been isolated. And once they finished the period, they were brought back into the total school population. Since the closure of school from the 18th of December, many of these students who were once in dorms would have gone back home, and we know that in some communities there are transmission of COVID-19. So upon them returning on the 4th of January 2021, we would want to ensure again that we test them to make sure that they don't have any signs of COVID. And once they're negative, they would be placed in the general dormitories. If, however, there are any positive cases, then we would isolate them, of course. We have had a very detailed meeting with the Ministry of Education, and each RHO, Regional Health Officer, and the Regional Educational Officer have met, and they have come up with their plans for the regions. And we, on our side, from the health perspective, we have sent out enough test kits, and this includes both antigen kits and PCR kits to the regions, so that for all students who are coming into the dorms, that we'll be able to test them. We have also put in place mechanisms to, if we are doing the PCRs, to be able to return those very quickly to the laboratory in Georgetown so that we can make the analysis. And once we do that, we'll send back the results to the region. So I think the plans are well in advance, and some of the students, we understand, would start coming in from Saturday, some on Sunday, some on Monday. So as they come into the different dorms, we have mechanisms in place to be able to start doing the testing.
All right, just a confirmation. So there's a priority for the schools for those tests to be done immediately?
Yes, we have put the measures in place to make sure that testing can be done.
All right, and the other schools that are reopening across the country, I know that there are mechanisms in place like spraying and all that. How is that?
Ministry of Education, they have certain COVID guidelines to follow, so they are following those. We are helping them with the testing to identify if any student, have tested positive, and if they have, to then help them with the medical protocol for that. So for every dorm school, that arrangement has been put in place.
All right. Moving from that to now the guidelines that will be out. It's New Year's Eve or Old Year's Day, as people will say, and as expected, people would celebrate and so on, but you've been advocating for a very long time for people to follow the guidelines. Now, among those would be, of course, we know that bars cannot be open or so. Is there anything you'd like to say to citizens on this?
Well, we are living in unusual times because we are living through a pandemic with a virus that is easily transmittable. And therefore, we have to take precautions. the guidelines that we have in place would end as of midnight tonight, but then new guidelines come into place. So basically, the current guidelines have been extended until the end of January, and the curfew hours remain the same. So you know that 10:30 curfew begins, and so that remains the same. That hasn't changed. Opening up of bars and other places, that too has not changed. So I do hope that the relevant businesses and other entities take note of this, because if they go and have parties and all of that and the police come in, they'll be in breach of the law, and therefore they would be prosecuted.
What about those indoor parties?
Same thing, because there are prohibitions on how many people can gather. And again, if these things are violated and the police intervene, then they'll face the consequences of the law.
All right. I wanted to ask you specifically about church service. I know we have spoken about that before, but given that it's Old Year's, it's one of those traditions.
Again, there are rules, and we have a curfew at the churches. Everybody knows this, from 10:30 to 4 o'clock in the morning, and therefore people need to abide by that. I don't think there's any prohibition if people want to go to church before these hours, but once it's 10:30, then people should be at home. You know, in Europe and other places, there are lockdowns. Those people are as religious as our people, and they are abiding by those rules. In Italy, there's a lockdown. In parts of Europe, there's lockdown. In the UK, there's a lockdown. In Canada, there's a lockdown, and people are abiding by the rules. So I really hope that people would work with us to make sure that we can contain the spread of this disease, because if we don't, we'll see surges and spikes going into the new year. And if not properly managed, that can easily overwhelm our healthcare system. As you would know that the private hospitals are not taking in COVID-19 patients. All of those patients have been managed by the public health system. And if people behave irresponsibly, we would see a spike in cases, and they would be coming to the public system, and we can easily get overwhelmed. So I'm really appealing to people to take precautions and to make sure that they abide by these rules, so that we can minimize the spike of COVID-19 as we go into the new year.
Okay. Minister, I just wanted to take you back a little bit. Since you came into office, you have been working, you've instituted a number of measures and so on. I just wanted you to reflect a little bit on some of what you've done, and basically your thoughts on how much you've done, but more so what else needs to be done, and how soon the ministry will be working on those.
Pertaining to the COVID-19 response, I think we have been able to stabilize the response. We have been able to get more test kits in and stabilize the whole testing arrangements. We have more capacity now at the National Reference Lab. We have brought in different modalities of testing, ranging from the antigen test to the point-of-care tests, and of course PCR testing. That, I think, is an important thing, because without having the capability of testing, then we would not know the extent of the pandemic in Guyana. And so that has been a very important thing for us. In addition to that, we have had our challenges with providing PPEs to frontline healthcare workers. So when we just got in, people were not getting enough PPEs, and we have rectified that situation, where literally we have, over the last couple of months, bought millions of different types of PPEs, whether it's masks, hair gongs, hair covers, gongs, shoe covers, and a whole host of other things that are necessary. So that we have also stabilized, and we continue to procure more because, as you know, these things are disposable. In addition to that, we've had our own challenges with having enough capacity to treat patients. And so most of that capacity was at the Georgetown Hospital. We have now activated the Ocean View facility, where we have 25-bed ICU, and we have extended the capability for persons who need hospitalization because of COVID. So we have more space. We can now probably accommodate more than 150 persons at Ocean View, plus a 25-bed ICU. And we have all the equipment there, monitors and ventilators and CPAP machines and so forth, to be able to manage these patients. In addition to that, in terms of treatment of the patients, you would require things like the drugs that can interrupt the life cycle of the virus. And so we have brought in remdesivir and made that available. And of course, in terms of regulating the immune response of the body, because some people have a hyper response called a cytokine storm, you would need certain medication to mediate that response, things like dexamethasone and so on. So all these things are available at the ICU. So we have come a long way from when we just got into office and what we met and what it is now. There's a vast difference in terms of the health and medical response. Of course, in every region too, we have built some level of capacity to be able to offer treatment to patients who would require respiratory support and other types of support. So that has been done. In addition to that, persons who are more at risk would be older persons and persons with chronic non-communicable diseases. And again, if they're not controlled, if they don't have medication and their diabetes is out of control, that would put them at an increased risk. So we have been able to procure medicines to address these needs of patients with these various illnesses. And those medicines have been distributed across the country to our health centers and other facilities where we're seeing patients. So hopefully we'll bring under control these chronic non-communicable diseases and put less patients at risk for the disease. Shortages of medicine has been a critical problem, and we did an emergency procurement of $3.4 billion worth of medicines, and then we have now put in a bigger order which would take us over for the next 14 months. So in a short period of time, we tried to stabilize the medical supplies. And of course, with our laboratories, we've had critical shortages of reagents, and that too we had to address. Things like blood bag and supplies needed to test blood at our blood banking facilities, and so all these things were in very short supply, but we have been able to fix them and stabilize the situation. The other area that we have worked on is to try to resume things like planned surgery. So we have been working to get back like GPHC up and running and start working to clear the backlog. So these would see improvement in people getting shorter waiting times and bring some sense of normalcy back to the hospital. So in the new year, you will see us doing more of that. We will be working to clear a lot of the backlogs that we have with surgery and getting back the surgical teams to work faster. And because we are now using the antigen testing at the hospital, we will be able to test everyone that is coming in and to make sure that we have a COVID negative environment in the hospital. Similarly, at the regional hospital, we are getting them to do the same thing. And so we want the system to work more effectively to help patients with other conditions. And of course, if they're COVID-19 patients, we have the capability of detecting them, treating them, and returning them back to some sense of normalcy.
Okay, thank you, Minister. You've mentioned regional twice, and I think we should probably expand on it a little bit, because you've been very passionate. It's one of the things that you've wanted to do since you come in, and we've spoken about it, developing the regional ICUs, and especially during COVID-19.
Well, each of the regional hospitals now have capabilities because we have given them ventilators, things that they never had before. So they all have ventilators, they all have oxygen concentrators, which are necessary for them to work with persons with respiratory distress. So we're very pleased that we've been able to do that. I think that's an important development for the region, and we have also provided training for the persons in these regions so that they're able to use the machine and be able to offer that type of assistance to the patients.
Okay, Minister, thank you so much. Before we go, I just wanted you to send some greetings to the nation. Of course, All Year's Day again, or New Year's Eve, as they say.
Well, I want to first of all thank the healthcare workers who have really did extraordinary work this year because of the type of work that they have done and because of their selfless giving. I think we have been able to manage this pandemic in Guyana. It could have been far worse, but because these persons who have been working in the healthcare system, doctors, nurses, other categories of healthcare workers, have certainly contributed to the reduction of these cases. Many of these personnel have gone way beyond the call of duty, staying there with patients, helping, and we are very grateful for their efforts. Because of their efforts, I think a lot of people are alive today, and we must be grateful to them. We'll continue to work with them. We want to ensure that we can improve the knowledge, and every day, as you know, knowledge on COVID-19 is changing, guidelines change, and so we'll keep our staff updated so that they can perform better. And we are very optimistic that in the new year that we'll be able to get vaccines. And the first set of vaccines that we'll receive, we want to give it to our frontline healthcare workers so that they can be protected. And of course, we are hoping that we can roll out this vaccine during 2021. So if 2020 was the year of the COVID-19 disease, we want to be optimistic that in 2021, we'll start pushing back against this disease, and next year would be the year of the vaccine, so that we can roll that out, get people immunized, and get people to get back to some sense of normalcy.
Okay, Minister. Thank you so much. You have been very accommodating to us, so we want to say thank you very much and hope you enjoy your new year as well.
Well, I want to also thank DPI for the work that you have been doing and helping to get the public, keep the public informed about everything that is happening with COVID. And I think because of your efforts that, people are more knowledgeable about COVID-19. So we want to thank you, and we want to encourage you to continue the good work.
Thank you, sir. All right, well, that's it for today's COVID-19 update. Of course, we just spoke to the Minister of Health, Dr. Frank Anthony, who has always done a good job at explaining to us all these medical terms. So remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy. And of course, we hope that you have a blessed new year, and remember to practice your social distancing and, of course, wear your face mask.